Hey, good morning, everybody. Welcome to our webinar this morning. We're really excited that you all can join us. My name is Michael Colon. I'm one of the marketing directors here at Messer Financial Group, not to be confused with Micah Matthews. There are two of us. There's a Michael, that's me, and a Micah in the office. You probably hear Micah talk more often than I do on these webinars. So anyway, we're really glad you guys are here. We're excited for Humana to be here with us today as well. Melissa Conwell and Kim Klein are going to be presenting some of the Humana's perks and plans. It's going to be a great webinar. If you guys have any questions, make sure that you just fill it out in the little question box in the control panel, and then we'll be answering them towards the end. If it's something kind of urgent, I might interrupt Melissa or Kim and just ask the question so that they can answer it on the spot, but we'll usually hold them to the very end. For those of you who are not with Messer Financial, one of the things that we do for our agents is bring opportunities like this so you can learn more about carriers to give you some additional support so you can be super effective in the field. If you have not heard, we also offer a quoting and enrollment platform for MAPD, which you can quote and enroll Humana among other carriers 100% compliantly, 100% telephonically. So all virtual, which is amazing. We can talk about that another time. If you guys have any questions about contracting, most of everything we have is on our website at messerfinancial.com. You can go underneath opportunities and hear about our all-in program. Those are agents who are with us for everything. So if you had all your Medicare Advantage, all your ACA, all your life, there's perks for being with Messer Financial. Outside of the unparalleled support we can give you, we also offer things like true group health insurance to you guys, retirement plan matching, the software program, free leads during the AEP. So there's a ton of support that we can have. If you guys have any questions and you can't get a hold of anybody in marketing because we're in meetings right now, you can always dial the office number. It's 704-568-9649. And if you hit extension 7813, that will actually go to one of our many producer support experts, and they can answer pretty much every single question you have. If you need anything else in the meantime, you can always email producer support at messerfinancial.com, or you can email me. It's mcolon, it's actually Cologne, COLON at messerfinancial.com, and I can help you out as well. So with all that being said, I'm going to go ahead and introduce Melissa Conwell and Kim Klein from Humana, gracing us with their presence. I'm going to turn it over to them. Thank you so much for being with us, guys.
Great. Thanks so much, Mike. Well, this is Melissa, and I'm going to start us off here. We're going to talk about some of Humana's perks and plans that we have. But first, we want to thank everybody. Our agents, we know how valuable your time is. We definitely appreciate you guys all spending a little bit with us on this webinar just to kind of learn more about us and how we can help grow your business. So thank you. Today's agenda, we're going to go through Humana Reach Rewards, the member care assessment, Humana Pharmacy, and a little bit of Humana at-home services. So we'll start with Humana Reach Rewards. This is one of our, what we call kind of our loyalty programs, and it's a way that we are able to kind of thank our agents for everything that they do with our members. So you get rewarded for the actions that you are probably already doing. So for doing everyday kind of work. Helps to keep you kind of energized to do more, learn more, and be more. And we always talk about human care, and so making healthcare more human. Went back a little. So what it is so we send out a lot of emails. So we have sent out some emails regarding Reach Rewards. You do need to opt into this program. So please be aware you'll want to use the email that is signed up and registered with Humana. So you would go out to humanareachrewards.com and you would request enrollment. So as you can see on the right side, that's exactly what it'll look like when you go in there. So you'd click on the Enroll Now, and then you would sign up with an email confirmation that would get sent. Reach Rewards is kind of geared towards recognizing agents and what their actions do, and it definitely matters for us. So you earn points. You can earn between 10 to 100 points based on the activity that you do, and you have a year to actually accumulate all of these points and earn different things that we'll kind of look at. These different actions are what earns you points. So for a new sale, whether it's plan to plan, whether MA, MAPD, all of those items. Um, for doing virtual training events. You can earn points through that Ignite webinar. We have a lot of training events that you can choose. We'll look at when you go into Ignite, the different logo that'll be out there to know what points you could earn for doing each event. We've got Humana surveys that we'll send out throughout the year that can also earn your points. And then going into that marketing resource center and downloading or ordering materials. And then these are the more specific points. So for those new enrollments, those have the highest point value at 100. So this past year, we had many agents make it to that gold and platinum status. So obviously the more business that you do, you can get there a little quicker, but it is possible, even if you maybe don't have necessarily all those enrollments, to be doing a lot of those training events and going into that marketing resource center and still earn quite a few points. Um, then on this next slide, these are the different things that you can earn with all those points. So those MRC, the marketing resource credits, so obviously, the more you do, the more you earn. At certain levels that you reach, you start off with $50 into the MRC, then $100 into the MRC. Then you can also earn those Kaplan Educational. One of the big ones, that premium agent customer service number. We have a lot of agents that'll work towards that gold status so that they can have that premium agent customer service number, especially throughout AEP. It gets you to a next level customer service than our basic agent support. You've got the AHIP reimbursement, Google My Business page. You do get an ambassador plaque if you reach our ambassador status. And then we do have some ambassador level training events if you reach that level that you could be invited to as well. Kaplan benefits, we have three different levels through Reach Rewards that help you kind of use Kaplan. So the professional development courses from digital marketing to public speaking, and then you can do the continuing education, the ethics, long-term care, social security, all those options. And then we also have personal coaching from a network of accredited coaches that can help to enhance your business. So that is one of the other options that are available through Kaplan. Again, so our dedicated customer service line helps you do more in less time. So again, it would take you to that next level that has a much smaller group of agents that would be calling in. So hopefully you can get through that process even faster when you make it up to that gold status. AHIP certification, when you take it through Humana, if you do qualify for that AHIP reimbursement, you would have obviously no fee when completing that. So definitely something to take a look at. The Google My Business page. This helps you stand out from the competition by making it easier for consumers to find you online and learn your story. So, in today's virtual and remote working environment, Google My Business pages, when someone goes out to search, this would help your information show up quicker. So it would be at the top of those Google searches. So it could be a very valuable, with everyone, they're starting to go back to work, but even still, Google is out there. So definitely helps to kind of build your business there. We would do all the work for you. So if you do reach that level where you would have the Google My Business benefits, we would set up your page and then send you monthly reporting to optimize that page and send you all those search results. So you could definitely get that information. So these are the different reach rewards levels that I was kind of talking about. So that first one, just for signing up, you're automatically a member of the program. Um, then, when you get to the bronze level, that starts to unlock those Marketing Resource Center credits. And as you move up the tiers, you can see, so at silver, you would then have 150 total in that MRC. Once you hit silver, you start to earn the rewards through Kaplan Educational Services. And then gold gets you to that premium agent customer support line. And then platinum would unlock the AHIP certification. And then ambassador is really has that greatest level of rewards. You'd have that plaque and then all of the Google My Business, and then you'd have that personal training with Kaplan. So that kind of gives you an idea of the different reward programs. Again, you sign up at humanareachrewards.com. You click through that email confirmation, complete your profile, and then your points would start earning as soon as you have that all completed. And we talked about what to look for, especially when you go out to that Ignite portal. If you're looking for training webinars, things like that, you're going to see that green and white star icon, and that gives you that opportunity to earn points. So definitely be on the lookout for those. MRC points are calculated daily. And so we'll track all of your points and the daily and sales engagement activities on a weekly basis. And then we tabulate those points and then send you a monthly email that shows the previous month's activity and how close you are to that next tier. So that's done automatically for you. We've set up, there we go. Phone went out. We've set up Reach Rewards to be very flexible. You'll earn points beginning, so our year runs from July 1st through June 30th of the following year. And then we have an annual reset each year to kind of level that playing field. So you unlock the points as you earn them, and then we also give you an extra 6 months to use those credits that you've earned from the previous rewards year. So it does, so any of those marketing resource dollars, things like that, they would go for a year and a half. So you definitely want to be cognizant of the points that you've earned, and you don't want to lose those credits, especially into that marketing resource center. And then again, as you move up in those tiers, you unlock MRC credits are loaded, and then you'll see new buttons appear for the Kaplan benefits. When you go into humanareachrewards.com, you'll want to kind of keep an eye on that dashboard because that's where you'll actually see the different items as you unlock them. All right, so again, just reiterating, humanareachrewards.com. It takes just a very short amount of time to get set up that profile, and then we'll track your rewards. Now we're going to shift over to the member care assessment. Definitely, we want to kind of help you understand a little bit more on how it helps Humana definitely learn more about the different members and dig into what we call social determinants. So the member care assessment is a formal post-enrollment kind of scripted survey that is administered by the agents for Humana Medicare plan enrollees. However, the survey is not shared directly with Humana. There are 11 questions, and as you can kind of see there, the different areas that we go into is housing, financial wellness, social connection, transportation, pharmacy, and then food securities. That is huge right now. It usually takes about 7 to 10 minutes to complete after an enrollment is done. This is really important because the member care assessment allows members to get their needs kind of served on a faster basis, and they can receive more support and potentially gain access to more resources. You can help identify any gaps that the members may have in their health needs, provide provider resources, and you can actually earn extra cash incentive for completing these as well. And it's always a chance to improve that client retention, giving them better service. Last but not least, Humana helps identify the gaps in the member health and to provide those additional sources and support when we know that a member has certain situations. So that definitely helps us. Um, Important to understand when a member care assessment should take place is pretty important. We highly recommend that agents complete the member care assessment at the point of sale. So after that enrollment is complete, it's a really great time just to go right into that. The member care assessment does need to be completed within 5 days of the enrollment. So please be aware of that. If it is done after those 5 days, you would no longer have that incentive for completing it. Um, the agents have, you would go into the Humana Market Point University and you would take the member care assessment training. What it is it's actually just a PDF that you would go through. But the really cool thing on that training is it does give you the 11 questions that would be asked for that member care assessment. It is a downloadable form that you could have on your computer. So, say you're in a situation where maybe you don't have online access, you would know the questions that need to be answered, and you could potentially get those responses. And when you get back to your, office or when you're back online, you could then complete that survey. When you register with Revel after you complete that training, what it is you will receive an email within 24 to 48 hours after completing the training on Humana Market Point University. You'll receive an email from Revel, and from there, you would complete your registration on that email. If you are already using Revel for a different carrier, when you go into that Revel portal after that 24, 48 hours, you will then see the different logos for the carriers that you have access to. And so you want to make sure, because we did this past year have a situation where an agent was using a different carrier to complete member care assessments. They need to be done by the specific carrier. So you want to make sure that you're clicking on that Humana logo if you have other carriers. From there, you would enroll the clients using an online tool, Enrollment Hub, FastTab, or even paper apps for us. And then after that application is complete, you would then ask the optional member care survey. And then so they say, yes, we would like to complete this survey. So then you log into that Revel portal and you follow that scripted survey. And then there are some additional resources that are available. So you're asking about food insecurities, loneliness, social isolation, transportation, and then the housing. Once that survey is complete, Revel sends those results of those questions to Humana into specific areas that they would affect. And then from there, you would receive that additional $50 incentive. It's paid out on a monthly basis, so please keep that in mind. Also, when it comes to AEP, they are paid out at the end of January because the plans do need to become effective. So definitely something to keep in mind. And here I am going to actually pass it over to Kim, and she is going to talk to you on the Humana Pharmacy Solutions.
Sounds good. Thank you, Melissa. Nice job. So let's get going on the Humana Pharmacy Solutions here. All right. And do you want to click to the next slide? Oh, there we go. Never mind. I can do it, I think. Okay, so a little bit about Humana Pharmacy for those of you that are not familiar. So Humana Pharmacy is Humana's mail order pharmacy. And as you can see from this slide, it is ranked #1 in consumer satisfaction by JD Power. So this is actually an award that we've won several years in a row. Pretty proud of it, and it does really, just kind of go to the impact that Humana Pharmacy does have. And then just a few other highlights when you are using Humana Pharmacy. Generally, there's no copay, for most tier 1 and 2 medications. There's an integrated care experience because they've got their Humana plan, and then obviously, once a few, documents signed, it does kind of make that a seamless transition for them into Humana's pharmacy, and we'll kind of go over that in the next few slides. We do offer digital tools where they can refill their prescriptions, check their status. On top of that, members have access to something called, I don't know if that's me. Okay, on top of that, members have access to something called Smart Summary. So this is a monthly statement that provides tracking information for all of their Part D drug expenditures. And it also, offers them some tips on ways that they can save on their prescription drugs. That main way, of course, one of those big ways being Humana Pharmacy. And then members can also access this information through myhumana.com. So this is a personal secure account which offers online resources to help these members compare costs, locate pharmacies, and a few other tools as well. And this can actually all be accessed on their phone as well. There's actually an application that your members can download and check it right from their smartphone device. And then we do have RX Mentor, which is a tool that enables members, to easily manage all these medications in one place. It also helps keep their prescriptions in one spot, manage their over-the-counter items, their vitamins, their supplements, help them keep organized with what they need to take day to day. And again, that is accessible through the iOS and Android mobile devices or via the Humana web portal. So there's a couple of different options that members would have to go ahead and access that information. So then if we want to move to the next slide here, medication non-adherence. So this is a pretty, big topic. There's a lot of things that happen when members, don't adhere to their medications, of course, as we can all, think about. But just a few, interesting pieces of information. So the frequency of chronic disease and the combination of low medication adherence does lead to adverse drug events. And as you can see from the screen here, approximately 1.3 million emergency department visits per year, right? So these are all things that could maybe be prevented. And then the lack of medication adherence increases health problems, and of course, in return, increases healthcare costs, which can affect plan pricing, kind of that spiral effect. And 76% of Medicare beneficiaries have 2 or more chronic conditions. So that's a pretty significant number just to take into consideration when you are talking to members about their prescriptions, and just maybe have that in the back of your head. And almost 3 out of 4 Americans don't take their medication appropriately. So that's the majority of Americans not taking their medication appropriately. And again, big adverse effects. So it really, we're going to talk about a few reasons, why Humana Pharmacy is a great, great tool for your members, and how that can really, help to counteract some of this stuff that's happening out there. So then if we go to the next one here, so, what is Humana doing to help, counteract that, right? So to encourage medication adherence for patients, Humana reaches out to its members who are non-adherent or those that are late to refill medications. So it's a proactive thing that we are doing to make sure that these members, are getting their medications and kind of checking in with them to make sure they're taking them. We're providing refill assistance, adherence counseling, and education materials. We also collaborate with pharmacies to promote adherence interventions. So that's including a 30 to 90-day conversation. We have medication synchronization, adherence check-ins, and much more. So we really are doing, whatever is possible to help these members stick to, taking that medication timely and appropriately. And then Humana also has prescriber tools to help identify non-adherent health plan members. So we've got reporting on that, which comes back to us, so we know, which members to go ahead and reach out to and follow through. And now if we go ahead and look at the next slide here, Humana has 5 key components. As you can see here, the next slide here. Thank you. So on this one, as you can see, we've got 5 key components here. So first of all, we've got the savings, right? So, members who are in Humana Pharmacy, average save about 15% on their 90-day prescriptions. And that's for the majority of our Medicare Advantage prescription drug plans. Humana Pharmacy also has a zero copayment on tier 1 and 2 drugs within the initial coverage. So keep that into consideration. So these are mailed directly to their door. There's no cost to mail that to them. And there's no copay on those tier 1s and 2s. And then as far as medication adherence, which we talked a little bit on the previous slide, this is something that we are very much committed to, delivering the best in care. And that's a big focus of our clinical programs, which helps to keep, member medication adherence rates at 80% or higher. So we really do strive to hit that number and make that impact there. And then in addition to that, we do have a reduction on 90-day readmission rates for our, one med programs. So that's another really nice thing to go ahead and call out. And then, of course, it is easy to use. It's convenient. As I mentioned before, we've got that mobile app, again, iOS or Android, or they can use the website. Of course, they can always call in if the smartphone or the website is not an option for them to member services. We're happy to talk to them over the phone. But they also have the ability to scan with that app, scan their medication and refill it using their application, that app on their phone. So pretty nice there. We do also have some built-in reminders and alerts that they can get if they set that up on the web and mobile profiles. So, that's just something, as you guys are checking back in with your members, once you've written them, you're doing that outreach just to make sure they're happy. The more that you can help them kind of make sure that they're utilizing these tools and really, taking advantage of what's out there, that's going to just speak to higher retention for you. And of course, more callbacks and potentially referrals as well. And then also, we do have, to just touch on accuracy and safety, we do have a 2 pharmacist check versus a 1 pharmacist check. So that is to ensure that all the members are receiving the correct medications, the correct dosing. So it is really nice to have that 2-point check versus if you're just going to another pharmacy where you've got that 1-point check. So you can really feel, good in your referral and helping them to utilize Humana Pharmacy. And if we move on to the next one, this is just, as I had mentioned before, I think we went back one. There we go. Okay, so this is just, our, JD Power Award that we've ranked. So the last 3 years in a row, Humana has actually received this #1 ranking in customer satisfaction, my goodness. So this is a phenomenal award and just a great recognition. And it's just something that you can absolutely go ahead and tell your members, if there's any concern about getting, their prescriptions through the mail. Sometimes that can be a concern, but, they are packaged nicely. Anything that needs to be, refrigerated is done so appropriately. And, it is a really good service that has a lot of eyes on it. So it's consistently, as you can see, ranking very highly. And we also, encourage you to do this. It does help with that continuity of care. So, and as we move on here, so why does this matter, to you all as agents? We talked about all these different things here: retention, adherence, the over-the-counter items, which they can do through there, the engagement. These are calls, these 30, 60, 90 days are calls that you all can make to help, keep that member engaged. We all know that it's like a crazy world out there, and there's lots of agents, right? So that member retention is huge, and the more outreach that you can make that's effective and impactful to your member, that better retention, better referral source you're going to gain from your members. So with COVID, it's been kind of a whirlwind this last year, and actually over a year now, I guess, if we're really thinking about it. So we know that, many of these members are choosing to stay safer at home, and therefore there's less, face-to-face interaction with these members, and probably less, review or whatnot of the medication. So for all these reasons listed above, it's increasingly important that we make sure that these members get their medication and that they're using Humana Pharmacy so that these checks and balances can really be in place, and these members are staying on the correct medications and good paths of health. So if we move on here, an ask that we are asking of all of you is the Humana Pharmacy Consent Form, and why this is important. So, while Humana Pharmacy is a Humana-owned company, it is administered by a third party. So that means that we can't just, send a member's information once you enroll them in a plan to Humana Pharmacy to do that outreach. That member has to initiate some sort of consent to Humana. So keep that in mind. If you want that seamless, great experience for your member and they want those mail order prescription drugs, there is a form that you need to do at the time of sale. And that form is the Humana Pharmacy Consent Form, and we'll show you a few ways that can be done. But additionally, if that's not done at the time of sale, or you come across a member who wants to now switch to Humana Pharmacy, you do want to make sure that they get that consent, because we can't just reach out to them. So they can absolutely call into Humana, request that, and initiate that over the phone. And from there, we reach out to the provider to pull their prescriptions in. But really, if you want that seamless, overall care, definitely make sure you fill out that consent form at the time of sale. So then if we move on here to the next slide, this is what it's going to look like if you are using our Humana Enrollment Hub. So once you've submitted that enrollment application, this does come, post that application. So once you've submitted it, it's going to see at the bottom there, it'll say, does the applicant want to complete the Humana Pharmacy Consent Form today? You get a yes, no, or left a booklet. So anytime you can click yes, it's a couple simple clicks, and then that member can just authorize and sign it. And it's nice and seamless, and then we can go ahead and do that outreach to that member. And then if you want to go to the next slide here. So the Humana Pharmacy Consent Form will be added to all the forms of electronic enrollment, for AEP. So it is on there for your members to use. So definitely make sure that, as you guys are reaching out and working with these members, that you do check those boxes and make sure that they are going ahead and, getting enrolled in that. All right, and then if we go to the next slide here, so this is the other option, right? So you guys would all be under partner there, so that would be the number that you'd want to take down. But if you have a member that hasn't done this through that online consent form, or they've not done it through the paper application, you can always call in at any point, or they can, and do this over the phone. So we'll go over everything with them on the phone. They'll do outreach to the member if they need any more additional information, but they simply initiate the call through this number, and that's how that will go ahead and get started for them. And then these are just a few of the important contact numbers that your members would need. So you guys can go ahead and write these down. As far as, pharmacy, you've got the numbers up there. Over-the-counter products, those can be done through the form in the mail. Otherwise, they can always go ahead and place that order through Humana Pharmacy at that number below as well. So lots of different options. If you guys want to take a minute, just kind of write some of this stuff down. I'll let you go ahead and do that.
Hey, Kim, while people are writing down these phone numbers,
Yeah.
there was a question specifically surrounding insulin. So they wanted to see if you could review the new insulin senior savings program. Specifically, does the cost share for these drugs count towards the max out-of-pocket in the ICL? He mentioned he understands the copay applies through all phases. However, does the cost the carrier pays in the ICL apply towards pushing the member to the donut hole?
Yep, and we can actually we can pull that up. Let me pull that up, and we can go over that here. Give me 1 second to get that pulled up while you guys are.
And while she's pulling that up, there was one more question that I can answer. Somebody had asked about the member care assessments. Now, obviously, you can do them right there on the couple of ways that that Melissa had mentioned, but the question specifically was, can you do the MCA if you enroll people through MyMFG, which is our electronic enrollment platform? Yes, you can. The way it works, if you utilize MyMFG, is at the very, very end of the application. After you've submitted it, you get a confirmation page that has the confirmation number, all the essential details for your customer, and on that document, there is a link for you to go and do the MCA. So yes, you can do the MCAs if you're enrolling people through MyMFG.
I'm still pulling that document. I'm going to see if I can't maybe try to.
No worries.
I was going to say, I was going to add on to that. If they don't, say they close out of that, site or anything like that, on the Humana Vantage portal, under that quote and enroll section, we do have a specific link that goes out to that member care assessment, because again, it is also available should someone choose to do a paper app as well. So we have that separate link, so just in case.
Great. Yeah, that's really, really good. I would say too, I feel like for Humana, you guys are offering 5 days for those MCAs when I think most of the other carriers are saying 20 or 48 hours, unless
48 hours.
A lot of them have changed. Yeah, so I think that's just one more perk, right, of doing business with Humana. You've actually got 3 more days to submit those, that document and get paid for it, versus the other carriers only making you do it, within 48 hours. So just keep that in mind as well. So just something to think about. And then, I just wanted to reiterate the member care assessment. Guys, I think it's really vital. It's great that if you do this MCA for your customers, you get paid a small bonus, which, is nice. But I think that the member care assessments are so valuable in giving the carriers insights into your customers' health so that they can continue to build better plans and be more effective in the marketplace. So, make sure you encourage your clients to participate in that. And again, shoot for the extra amount of money you get. You do 100 of those, you're gonna have a nice weekend.
And if I could maybe just add to that as well. I mean, if we're talking retention, right? If you're talking about keeping your clients happy and keeping them with Humana, just doing that, simple 11 question, 10-minute, 10-minute or less survey is really going to give us some valuable information. We're going to, I realize it's not always comfortable to ask some of those questions, but there are different ways that you can phrase it, and it does, once you've done it a few times, become pretty comfortable. It does really help with that retention and that member overall satisfaction with their plan, because if there is anything, out there that they're having or struggling with, that's something that we can always do that outreach on. So
yeah, that's great. Looks like there's another question here. It says, is there a way to verify if a specific SEP has already been used, such as Medicaid, which can only be used once a quarter? So while they're sitting there talking to somebody, there's like a 800 number, anything that they can call to determine that, so that they're not submitting business and wasting their time and getting their customers' hopes up.
Yeah, I believe agent support can verify that. And I can pop that number in. I think it's only letting me pop it into organizers and panelists, because I did throw in the Humana Reach Rewards as well. But I'll put it in there, and maybe, I don't know if you want to share it with everybody.
Are you talking about me sharing with everybody?
Yeah, it will only it lets me do it to organizers and panelists.
And actually, I think Bobby might have to be able to do that. Bobby, are you able to share?
Or, what we could do is we could just email all this information to you post-call.
Yeah.
That'd be easier.
Yeah,
because I've got to ignore the
send it out that way.
Yeah, that's fine. It's not a problem. That's not a problem at all. Okay. And for those of you who are interested in, maybe you missed part of this webinar, if you actually go to Messer Financial's website underneath producer services, agent services, there's going to be a little tab for our Messer Learning Center. So you can actually go back and listen to this webinar if you missed part of it. But then also we have past webinars too. So I was literally just thinking about, Mark McMullen is always pushing the veterans kind of program, right? Because he's an ex-veteran. I guess always a veteran. You're always a military service provider, but he's not in the military currently, and so he's very passionate about that kind of demographic of clientele. And Humana is very actively engaged in the veteran community as well, which I think is awesome. You guys have some amazing plans that can help those people that, can go and get services elsewhere. So, just keep that in mind as well, because Humana has a ton of support to offer agents. We really appreciate, partnering with you guys. You guys have always been a really good partner to us, and we're here for you guys, the agents. We're gearing up for the season. At some point in time, we'll hear about expansion counties in the near future. And then next thing you know, people are going to be knocking out their AHIP, doing certifications, and the AEP is going to be upon us again. So if you guys need anything in the meantime, literally anybody here at Messer Financial is happy to address any questions you may or may not have. Anybody in producer support, like I said, would be able to answer those questions for you. You can call me here at the office. My extension is actually 7732. Micah Matthews is another marketer counterpart of mine. His extension is 7728. You can give us a call, and we're happy to answer any questions that you may have in the meantime. And then we'll try to send some slides out to you guys, everybody who participated, so that way we can get you all the information that you need. And if I don't see any more questions on here, we do appreciate everybody joining. It's about 9:45, so we'll wrap it up so we can respect everybody's time. Melissa and Kim, thank you so much for joining us. We really do appreciate all the insight that you've given us into Humana.
Absolutely. Thanks for having us.
Yeah, for sure. Well, we appreciate everybody. Have a fantastic day. Go enjoy the beautiful weather, and we'll talk to you all soon. Thank you so much for your time.
Bye, everyone.